Welcome, everybody. We'll get started in just a few minutes. Thank you for joining us for the Aging in Alaska Lunch and Learn. Your lines are currently muted, and we'll ask that you stay muted throughout the presentation. You can adjust your view in Zoom up in the right-hand corner to either see just the current presenter in speaker view or gallery to see everybody who's got their camera on or has a thumbnail up. And if you have questions throughout the presentation, go ahead and route them through the chat box. We may or may not get to the questions at the end, but any outstanding questions, we'll get answers from the presenters and get those back to you by email afterwards. Well, welcome everyone. We'll go ahead and get started. Welcome to the Aging in Alaska Lunch and Learn, and thanks for taking your lunch hour to spend with us. Your lines are currently muted, and we'll ask that you stay muted throughout the presentation. If you have questions, you can put them in the chat box, and we'll try to get to them at the end. If we don't, we'll have presenters answer them, and we'll send it back by email following the presentation. If you want to change the view so that you can see the full gallery or just the speaker, you do that in the top right hand of your Zoom window with speaker view or gallery view. I'm Marge Stoneking, Advocacy Director for AARP Alaska. AARP is a social impact organization serving Americans 50 and up. We have a broad mission focused in the areas of financial resiliency, health security, and social connection so that all people can choose how they live as they age. We have over 75,000 members in Alaska, and we'll be sending out your district membership totals to registered legislative offices later today. Our agenda today includes presenters from 5 senior advocacy partners who will each share their organization's role and cover one aspect of aging in Alaska. These partners all share some of the same legislative priorities, but also some different, but that won't be covered today. Legislators will hear from each partner's advocates sometime this month. So the senior population is growing nationwide. That's not news. We all know the population trends that baby boomer generation has written throughout their lifespan. Alaska does have the fastest growing senior population per capita for the 9th consecutive year, in fact. And there are only 3 states that are growing at over 50%, Alaska at 69%, Nevada and Colorado both at 57%. Alaska's senior population has increased in every region across the state for the last decade, or over the last decade, excuse me, with Southeast having the highest population of seniors. So why? Why is that? What's different about Alaska? Well, if you look at a population trend line for Alaska, we've had fairly steady growth in population since the end of World War II up until recent years. However, there were a few growth spikes. The largest spikes by far happened in the second half of the 1970s with pipeline construction, and then in the 1980s with the oil boom. And if you came to Alaska to work during those times and stayed to make Alaska your permanent home, as the vast majority of people did, you're now an Alaskan elder. But Alaska's population's in decline, so how can Alaska have the fastest growing senior population in the country? True, our general population has been on a slight decline for the past 5 years. However, that's not the case for our elder population. In fact, that population has had a slight growth each year. And without migration and low birth rates overall, elders have grown in proportion to all the other age groups. And we intend to stay here. 2/3 of Alaskan residents 45 and over are currently living in Alaska full time during retirement or are planning to do so in the future. And this is according to a very recent survey by AARP Alaska. Another 22% plan on living in Alaska part time. Most notably, only 5% of those who surveyed responded that they have no plans to live in Alaska after retirement. According to this AARP Alaska 2020 survey, only 5% of Alaskans 45 plus intend to leave Alaska at retirement. The economic contributions of older Alaskans as consumers, workers, business owners, and taxpayers fuel our state's economy and continue to contribute to its recovery, growth, and economic opportunity for all. The purchasing power of Alaskans 50 and older generates tax revenues, creates jobs, and creates stability in other important areas like healthcare, housing, and transportation for essential workers, families, veterans, and small business owners, all of whom were very hard hit by the pandemic. On the top left, you see direct spending portrayed on a dollar bill. 52 cents of every dollar spent by people 50 plus in 2018. And that will be projected to be 58 cents of every dollar by 2050 due to the growing senior population. This is Alaska specific. On the top right, you see direct spending for select consumption categories, including healthcare, housing and utilities, leisure and hospitality, financial services and insurance, and technology. The red lines reflect 2018 actuals and the gray 2050 projections. And on the bottom, that direct spending also impacts jobs in industries related to those spending categories, especially government, health services, wholesale and retail, leisure and hospitality, professional and business services, and finance, insurance, and real estate. And 50 plus Alaskans represent more than a quarter of our total workforce, projected to grow to a third this decade. Older Alaskans are committed to strengthening family and community. They are primary caregivers for family and friends and help to raise grandchildren. They are vital volunteer leaders across our state. These unpaid contributions help countless families, children, veterans, and communities achieve health, social, and economic security. They also save our state and communities resources by alleviating increased reliance on strained government services. And when it comes to giving back financially, older Americans are far more likely to make monetary donations to charities than adults under 65, 72% versus 55% for the total population. And older adults are more likely to donate more, giving more than $1,200 annually versus about $800 for the total population. And then, of course, there's citizenship as measured by voter turnout. And as you can see, the voter turnout increases in general with age, with the 65 to 74 category being the highest, in particular in the last presidential election prior to 2020. And now I'd like to introduce Lisa Morley, the Executive Director of the Alaska Commission on Aging.
Good morning, everyone, or I should say good afternoon. Thank you. My name is Lisa Morley, and I am the Executive Director of the Alaska Commission on Aging. The Alaska Commission on Aging is a federally funded organization representing the needs of older Alaskans under the guidance of the Older Americans Act. Senior and Disability Services, which is in the Department of Health and Social Services, along with the Alaska Commission on Aging, are considered the state unit on aging for the state of Alaska. Every state has a state unit on aging, and they're divided up between either one organization or multiple organizations. In order to have and receive federal funding for programs that serve seniors, every state needs to have a state unit on aging. The Alaska Commission on Aging is comprised of 11 volunteer board members appointed by the governor, whose primary responsibility is to represent the needs of seniors throughout the state. You can go to the next slide now. The Alaska Commission on Aging does not administer senior service programs or services. We advocate, we educate, and we advise how various policies and programs impact the lives of seniors. Next slide. In addition to those activities, the Alaska Commission on Aging, along with our partners, developed a 4-year state plan for senior services. Our state plan encompasses distribution of Older Americans Act and other funding throughout the state, as well as evaluates the impact of that funding. In addition to coordinating with our senior service providers and senior and disability services, the Alaska Commission on Aging coordinates with the Alaska Mental Health Trust Authority to represent the behavioral health needs of seniors, including individuals with Alzheimer's disease and related dementia and their caregivers. In preparation for this 4-year state plan, and also for making recommendations for the Alaska Mental Health Trust Authority, the Commission on Aging does surveys throughout the state to survey the needs of seniors statewide. So we hold listening sessions, we do surveys. Our goal is to gather as much information directly from seniors throughout the state as possible. In addition to gathering that information and doing a senior survey, we promote public awareness of senior issues and evaluate the availability of a wide range of services available to seniors statewide. This is very important because of our increasing senior population even though our general population is dropping, our senior population is rising. So we need to evaluate those programs and make sure there's senior services available to seniors throughout the state. Next slide. The Alaska Commission on Aging partners with all of these many organizations pretty regularly to make sure that the needs of seniors are known and utilized when making decisions or policy making throughout the organizations. The Alaska Commission on Aging represents all of the needs of seniors, but focuses on the vulnerable population including seniors who live in rural areas, minorities, individuals with disability, and seniors living below the poverty level. Next slide. The Alaska Commission on Aging represents all seniors 60 and over in Alaska. And to give you a little perspective, there are 142,000 seniors right now living in the state of Alaska. And of those seniors, probably about 35,000 receive some sort of senior service or public assistance. So that's a large percentage of seniors that are private pay and have caregiver services and don't utilize state resources. However, we do want to still consider those seniors, and the Aging and Disability Resource Centers, which is listed right here, this is the 1-800 number. This is a resource for all seniors. So it is not just a connection to public programs, but it is also a connection to private pay or any resources for seniors and caregivers throughout the state. All right, well, thank you very much. If you have any questions, our contact information can be provided to you. I'm in Juneau right now, and I'm a state agency, so you can always look me up in the state employee contact. Our next speaker is the Alzheimer's Association. And I'm sorry, I just blanked.
That's okay. I'll take over.
Okay, thank you. Sorry.
You're welcome. My name is Rhonda Scott. I'm actually an advocate for Alzheimer's Association. I'm a volunteer. They approached me about 3 years ago and asked if I would be willing to call on our congressional delegation in Washington, D.C. to advocate for research funding, which I am more than happy to do. You'll hear my story about Alzheimer's, but it's a privilege to be able to help the Alzheimer's Association. They are the third largest research agency in the world. The first is the People's Republic of China, and the second is the United States government. So the next slide shows a picture of me and my mom, and this is why I have a relationship with Alzheimer's. I didn't see these pictures yesterday. 1 second. I love the picture on the left. It's a picture of Mom and I in our kitchen baking cookies. And she always had this funky little hairnet that she had to put on when she baked cookies. I don't know where she got this hairnet, but I'm like, Mom, lose the hairnet. So our parents came to Alaska like so many other families did. They drove the Alcan Highway in 1954, pregnant with my older sister, Sandy, and they raised 5 kids here. In 2010, my mom had been remarried, and her husband approached me and said, something is not right with your mom, and she's forgetting things. And to be quite honest, I think all of us recognized that, but we were, just turning a blind eye to it because Henry was taking care of business. So when Henry reached out, I personally reached out to Alzheimer's Resource of Alaska, and they're life-saving. They were able to help us navigate everything that we had to do to help Mom with her dementia. So in 2011, my stepfather passed away. And by then it was glaringly clear that Mom needed a lot more help than we were able to do individually. So at this point, Mom started taking classes at Alzheimer's Resource. She took 2 classes a week. I took all of the caregiver classes that they offered. And the support there and the resources there were awesome. And everything, all of the services that I received were free, which to me is still amazing to this day. And I can't tell you how many times I would just call, say, hey, I just have a quick question. And an hour later and a Kleenex box later, I was still talking to them. I can't even say enough about them. We were lucky in a couple of respects. Mom always had a great disposition, and for that we are blessed. And financially, we were lucky in that we could provide services for Mom that we paid for out of pocket. So we had someone live with her full time. We had a caregiver drop by a couple of days a week, and she had a full-time driver as well. So she started taking their classes, and it was enlightening and also good to know that we weren't the only ones. And in retrospect, we were very lucky. Some people just had so many more issues than we had. So our regular agenda was I'd pick mom up every Friday night. We'd stop by the grocery store for emergency ice cream, which everyone always needs, and then go home and bake. And so one Friday evening, we were baking cookies, and I asked mom to get the milk from the refrigerator. And out of the corner of my eye, I could see that she didn't know where the milk was. And she looked in the pantry, she looked in the cupboard, she looked in the microwave. It was heartbreaking. It's heartbreaking to see someone that's physically alive lose their memory and lose all cognition. So we had some very difficult decisions that had to be made. My sisters and I, kind of didn't agree on all of them. There was a lot of strife in the family. Mom wanted to live in her house that she had lived in for more than 50 years. And one of my sisters wanted her to go to a home. So mercifully, my mother was able to stay in her home until she died. She had a massive stroke and died. So for that, I'm grateful that she was able to live in her home until she passed away. After she passed away, I committed to supporting Alzheimer's any way I could. I am an artist. I donate 10% of my annual sales to Alzheimer's, and I'm happy to advocate for them at every opportunity. I got a phone call this morning from a friend who has a friend who I referred to the Alzheimer's Association. So that's my story. And the next slide kind of shows the Alaskan story. Like so many other Alaskans, they are dying from dementia. In 2019, the data shows that there were 370 deaths from dementia and 156 specifically from Alzheimer's. 61 were from vascular dementia and 153 were from unspecified dementia. And I kind of crack up at this slide because at the bottom it says these numbers do not include deaths from alcohol dementia. And one of my mom's favorite sayings was, I'm 80 years old, I've never smoked, I've never drank, and I've never cussed. And we'd always laugh and we'd be like, okay, maybe 2 out of 3, Mom. And then the next slide shows the impact to the whole state of Alaska. And currently there are more than 12,000 people living with Alzheimer's or some other sort of dementia in Alaska. And that number is going to increase exponentially by 2030. It shows an increase of 90%. And then of course, the unknown is what COVID is going to have, what effect that may have on dementia as well. So I'm happy to always advocate for Alzheimer's. I'd love to find a cure in my lifetime. And with that, I give you the Executive Director of Alzheimer's Resource of Alaska, my good friend, Pam Kelly.
Thank you very much, Rhonda. Just a tough act to follow. Rhonda was here speaking on behalf as a volunteer for the National Alzheimer's Association, which works in Alaska in the areas of advocacy and research support. But she is a huge friend to the organization I lead, Alzheimer's Resource of Alaska, which isn't an affiliate or a chapter of the national group. ARA is Alaska grown, and we're in our 4th decade now of delivering services to support Alaskans who are affected by dementia. Our 2 organizations aren't competitors. We simply do very different things. Often folks think we're one and the same, but we're not. If we're going to be talking about aging in Alaska, we're going to encounter dementia, whether it's of the Alzheimer's type or another. The impact is tremendous. That's why 24 Alaskans from tribal organizations, state and local government, healthcare providers, and nonprofits like AARP and my organization dedicated efforts this last year to developing a comprehensive report, the Call to Action, Alaska's 10-year map to address Alzheimer's and related dementia. It was published in January with funding from the Alaska Mental Health Trust Authority, and there's a link to the report in the chat box. One of the fundamental conclusions of the report is that to adequately support this part of Alaska's aging population, we need to make sure we support their caregivers. Caregivers include 2 kinds of help: formal caregivers who are paid for their work and informal caregivers who are unpaid, usually family members. The call to action report acknowledges that we particularly need to support these family caregivers who, right now, are estimated at more than 33,000 Alaskans. Our entire system of support collapses without them. If prevalence of those who have the disease is nearly doubling, which we know to be true in this state, so too will the number of these informal caregivers. In 10 years' time, here's what we can expect. Some 66,000 Alaskans as family caregivers, some 24,000 Alaskans experiencing dementia. Now that's 90,000 Alaskans living with dementia's impacts. And that's why we need to begin planning now, forming our strategic partnerships now, and identifying best practices now so that they can be locally available as this need continues to grow. The call to action will be used to set some benchmarks to measure our progress in doing right by these Alaskans. And we'll be convening regularly to evaluate. Next slide, please. My organization has been focused on education, training, support, care coordination, and other services for Alaskans affected by dementia for 37 years now. We're the only organization in Alaska dedicated to this. And while our work has evolved considerably over that time, here's what has not changed. We still don't have a complete understanding of why some of us develop dementia and some of us don't. We still don't have any real disease-modifying treatments, and we still don't have a cure. But we do have much better programs and services that help make things just a bit easier for our neighbors as they live through the experience of progressive, irreversible, and ultimately fatal conditions. Next slide, please. Now, I realize that not everybody who's on this Zoom has had experience with dementia in somebody that they know, and Rhonda certainly spoke eloquently to its impact in her family. I use this slide to remind myself to explain how sort of global the complications are that dementia creates for someone. A person with dementia has a brain that's slowly failing. And as brains start to change, we see a cascade of challenges that individuals experience with daily living. Difficulty remembering is a thing that sounds minor, but if you don't remember to turn off the stove, it's dangerous. Doing things, any task, in the right order is something that we take for granted. But getting dressed requires the right sequence. Or removing your clothes before getting in the shower. These can get mixed up. I counted once. There are 47 steps in getting, or used to be, in getting my mother into the shower. She never have staged that on her own. Getting that order wrong can be pretty embarrassing. Difficulty communicating is inevitable. Word finding at first, maybe progress to a kind of a word salad, but then eventually simply noise over time. Now imagine not being able to understand why you're not understood after a lifetime when you were. When memory fails and you don't recognize familiar places, finding yourself in one can be frightening. Or you can get lost in Alaska with tragic consequences. This is why over the 6 to 10 years that a person may struggle, they need increasing levels of assistance to get by until the need for care for themselves is total. Next slide, please. Now, in a variety of ways, the state supports necessary services, and these greatly benefit Alaskans experiencing or supporting someone who's experiencing dementia to the extent they are available and accessible in a community. And as you would imagine, in many of our communities, there is very little on the ground accessible and available to them. Our next presenter, Marianne Mills, will talk about how these kinds of supportive services fit within a continuum of care. Alzheimer's Resource of Alaska is involved in many, but not all of them. We all have a role to play, provided that we are aware of the need and provided that we're all ready to heed that call to action. I think that we are at one of those infamous inflection points. And so I hope that we can all join hands and heed that call together. Thank you for your time. Thank you for your attention. And with that, I'm pleased to introduce you to Marianne Mills, who is the president of AGENet and the program director for Southeast Senior Services.
Thank you, Pam. AGENet stands for Alaska Geriatric Exchange Network, and we're Alaska's Association of Senior Service Providers. Most of the members of AGENet are private nonprofit organizations, although we do have some individual senior advocates that are members, as well as some for-profit private agencies. AGENet's work is to develop senior services in every single community in Alaska so that seniors can age in place, remain in their own homes for as long as possible, remain in their own communities for as long as possible. We want people to live with dignity, safely, with good quality of life. Next slide, please. Here's who our members are at the current time. We are always eager to take on more members from different communities, as many communities as possible from around the state. So you might be familiar with some of these agencies in your community or even the individuals they are listed. Next slide, please. Home and community-based care saves money. I was expecting the slide of the continuum of care of community-based services and home-based services. Community-based services help save money, but help people stay at home for as long as possible. The sooner someone can get involved with the community-based services, the longer they can remain at home and avoid costly institutional care. Nearly half of Alaskans who are 85 years and older suffer from dementia. So how do we want to care for these people as a state? Well, we know people want to remain at home for as long as possible, but it also makes financial sense. If someone has care in a nursing home, it costs over $13,000 per month per senior, or $157,000 per year per senior. For someone who is eligible for the Alaskans Living Independently waiver, it costs $3,000 per month or $35,000 per year. In order to be eligible for the home and community-based Alaskans Living Independently waiver, someone needs to have a limited income and also be eligible for nursing level facility of care. Medicaid pays for waiver services. 50% is paid by the federal government and 50% is paid by the state. And former Representative Dan Sadler once said, waivers are savers, because he understood the value of supporting the waiver programs. And then, of course, the most popular and the least costly are the home and community-based grants at home, $42 a month or $509 per year per senior. With the grants and the Medicaid waiver, as we call it, the older adult can remain with dignity in his or her own home and community. Alaskan family caregivers are given support to continue providing unpaid care, whether it's an in-home respite worker or an adult day program in the community. Meals, rides, adult day, care coordination, case management, respite, and chore services safeguard elders from injury and deterioration, which leads to premature, costly institutionalization. Next slide, please. This is the one I wanted. So this shows you what we mean by home and community-based care. So on the left are the community-based services. That's usually where the the younger seniors, the more healthy and active seniors enter the continuum of care. And the longer we can, the sooner we can connect seniors with these services, the longer the delay will be along the continuum of care, the longer they can stay at home. So congregate meals in groups, sometimes that happens at the senior centers, sometimes it's even in the elementary schools, the elders go there. The congregate meals provide not only good nutrition, but also essential socialization to keep them healthy and active. Public transportation is critical to keep them connected with community resources, information, referral, advocacy, helping seniors access the services and benefits that will help keep them healthy and active. Alzheimer's disease and related disorders, education and support helps to raise the awareness of issues faced by families and communities regarding Alzheimer's. Health promotion activities, these can be Tai Chi classes, for example, that help prevent falls. Senior employment services, MAST stands for Mature Adults Seeking Skills Training. Independent living apartments for seniors, and then seniors centers where seniors come for activities and meals, meetings, and a community focal point to keep them active and vibrant. Senior volunteers, I'm sure we all know people that are volunteering in their senior years. And then legal services are critical, helping seniors get that free legal services perhaps, but even more important, I think, is getting that paperwork in order that we all need as we come near the end of our lives. So next is the home-based services, home delivered meals, which a lot of seniors are getting these days since the pandemic. Assisted transportation, where a driver can assist the senior from the door to the vehicle, help them with their seatbelt, help them with their wheelchair, and tie them down if tie their wheelchair down if they're in a wheelchair. Shopping assistance, home repair, senior companion volunteers. Those are seniors helping other seniors. And then homemaker chores is pretty much light housekeeping. So then along the continuum care is more intensive home and community-based services. Adult day services. Many clients in adult day have dementia, and it helps keep them active and vibrant and safe, while their family caregiver can get some respite, get a break from that caregiving. It really helps to extend their time at home and delay the time they go into a more advanced or institutional setting, such as an assisted living home. Counseling is available, family caregiver support. That could be training, it can be counseling, support groups, respite care, any sort of item that might help them make their caregiving easier at home. Then we've had in-home respite grants. We have home health care, hospice care, and personal care, which is hands-on bathing, dressing, feeding, things of that nature. And then, so for those home and community-based services on the left, that's basically what AGENet members do. Then you get into the assisted living homes and pioneers homes in a residential setting. That's 24-hour personal care. And then the most expensive is the institutional care for people that have medical needs in a hospital or a nursing home. Across the bottom, you can see adult protective services available for any senior. And then also case management helps coordinate the care for seniors that require home and community-based services. Next slide. So this is from the state of Alaska. It shows the cost of care at the various levels and also how many people are served. On the far left would be your senior grants, where you can see last year 34,000 people were served at an average cost of $509 per person. Then you go along to perhaps personal care services, serving 2,300 people at a $12,000 average cost. Then we go to the Alaskans Living Independently waiver, serve about 2,000 people for $35,000 average cost per person. But on the to the right, which we'd like to avoid if possible, is leaving the home and going to a nursing home, which costs on average $157,000 per year per person, with only 1,000 people, less than 1,000 people served. Is that the last slide there, Marge? Okay, great. So basically, we want to help people stay at home. We want to support senior grants for those that are eligible, those few people that are eligible for the Alaskans Independently waiver. We want to support those services to help people remain at home for as long as possible, because once we don't want people to leave their homes, and also it's very costly for them to go to a nursing home. So that's my presentation. Thanks for your time.
Thanks, Marianne. Well, that is the end of our formal presentation today, and we still have some time to be able to entertain questions. Daryl, do we have questions in the chat box that you could read out?
We do have a few questions, Marge. The first is, what is the status of the waiver in the current legislature?
Does anyone want to take that one? Lisa?
Hi, this is Lisa Morley from the Alaska Commission on Aging. The Medicaid waiver, the Alaska Living Independent waiver, currently there is a Medicaid bill to adopt the sorry, I'm losing my thought here. The optional services, the Medicaid waiver is a 1915C, which is an optional service, but there's currently, I don't think that it is at risk, but there is a bill, I think, to make the optional services permanent services. And I can get back to you with that bill number if you would like it, if you put your information into the chat box. Does that answer your question or not?
That question came from Patty, and Patty, if you'd like to add something to it, feel free to add something in chat, and we'll get your question brought back up. There is another question about waivers, and basically it asks to please clarify 50% Medicaid and 50% state. Are HCBs available or mandated in all states?
This is Lisa Morley again with the Alaska Commission on Aging. Just to let everyone know, I did used to work for the Division of Senior and Disability Services, who does manage the Medicaid waivers and the personal care services, as well as the grant services. So our organization does not manage that. That is Senior and Disability Services. And the waivers, the Medicaid waivers, as well as other Medicaid services, are 50% federal and 50% general fund. However, we do have a Community First Choice program, which gives the state an additional 6% match. And I think as well as that, for during COVID, I think we have also been receiving, the state has been receiving an additional match for Medicaid, but I would have to confirm that with the department.
Okay, and Lisa, staying with the theme of waivers, we have another question. In what legislative committee is the waiver addressed?
I would have to look at the bills and the legislations and get back to you on that. So.
Okay, and another question on waivers, are there legislative or administrative issues in obtaining waivers for those with dementia not properly coded for financial coverage when families have no financial resources, and how to correct this?
This is Lisa Morley. I'm gonna refer that to Pamela Kelly.
Thank you, Lisa. I'm a little bit opinionated on the answer to this question, and so please understand it comes from a place of supporting folks who live with dementia. I think there is an impediment to folks who have dementia in availing themselves of the benefits of waiver services, and that's the necessity that they meet nursing facility level of care when they're assessed. The simple fact that they may need prompting and cueing to get through literally every ordinary aspect of daily living is not in and of itself sufficient to reach that nursing facility level of care. The tool that we use to assess nursing facility level of care is targeted not specifically for those with dementia. That tool could undoubtedly be refined to benefit more individuals in Alaska who are living with dementia. At some point, that would be certainly a blessing for those who struggle.
All right, thanks, Pam. Our next question has to do with Parkinson's. And the question is, are there any services for the elderly who have Parkinson's disease? If so, who does one talk to access these services?
Well, anybody age 60 and older can access the senior grants in whether it's a case manager or meals or what have you, can help these people, that elderly that have Parkinson's or whatever. You just have to be 60 and older for the most part to access services.
All right, thank you, Marianne.
Yeah,
And
Lisa,
the place to start would be the Aging and Disability Resource Center.
that's what I was going to say.
Yeah.
All right. Our next question is, how is Alaska positioned in having enough residential care, for example, assisted living homes, for current needs and future needs? Do you keep track of that in our many Alaskan communities?
Hi, this is Lisa Morley from the Alaska Commission on Aging, and I would like to answer and then also pass it along to the others on the panel, because I think everybody has knowledge about this. As far as I know from anecdotal stories, there are not enough assisted living home beds in the state of Alaska. Most specifically, there's not enough assisted living home beds to care for people with Alzheimer's disease and related dementias. In addition to that, assisted living outside of Anchorage or Mat-Su is extremely expensive. So for instance, I live in Juneau. The only assisted living we have in Juneau right now is the Pioneers Home. And then also if you go out into the rural areas, there's no assisted living in Kotzebue, Bethel, Dillingham, Nome. So it's really limited to the road system.
Great, thanks for that. Our next questions have to do with the legislature. And Marge, this may be a question for you, but the question is, are these groups going to be meeting with legislators in the next couple of weeks?
That's a great question. Yes. So I believe next week, legislative offices will see the Alzheimer's Association and AGENet advocates. And the following week, you will see AARP red vested advocates, all on Zoom, of course, and the Alaska Commission on Aging commissioners.
All right, and staying with that theme, is there a bill number for current legislation that might address some of these issues, or multiple bills for that?
Nothing specific to what's been discussed in the questions here, and certainly all of these organizations have bill watch lists that we monitor, and some of those calls to monitor the bills are public, like the Commission on Aging quarterly calls.
Okay,
Yeah, this is Lisa Morley from the Commission on Aging, and what our legislative priorities, and I think along with also AGENet and the Alzheimer's Resource of Alaska, is to really maintain and support our senior services that we have in place now. Our funding for senior services has not grown over the past 5 years, even though our population has grown. So our main concern is really just keeping an eye on the budget. And the governor's budget does not propose any cuts to those senior services. And we do support those, maintaining and supporting those services.
all right, thanks, Lisa. Our next question has to do with adult daycare programs. So how many adult daycare programs are supported in Alaska, and what is the average admittance to this type of program?
Marianne, do you have that?
Marianne, do you want to answer that? I think there's 11 programs currently statewide, and the participation ranges anywhere from 4 individuals to 40, depending on the site.
Okay, and then our last question that we have is, where are the memory center evaluation facilities in Alaska where people can be evaluated?
This is Pam. I'll jump in there. A full-blown evaluation for any diagnosis for dementia really needs to be undertaken by a health provider. So that may be a neurology practice, that may be a principal healthcare provider. But a first step is simply a memory screening. And our organization does non-diagnostic memory screens. We're still doing them. We now do them, virtually, but they can be done to simply indicate whether, with a specific score, an individual should perhaps have a conversation with their family doctor and take it from there. But there really aren't any memory center evaluation facilities per se in the state of Alaska, as we might see outside.
All right, thanks, Pam. And Marge, that is all the questions we have in chat.
Great, thank you. Do any of the legislative staffers or legislators online want to ask additional questions live? Then we will go ahead and conclude. This has been recorded, and you will be sent both the slides and a link to the recording after this afternoon so that you can review it or share it or both. And again, thanks for taking your lunch hour with us. We really appreciate it, and look forward to working with you all to continue to serve seniors in Alaska for lives of dignity and purpose. Thank you.